Okay, now I can hear it.
Yeah, hello
Uh, so,
everyone. And
Hello.
today I would like to invite both of you to share the discussion about stem cells for CP children. So each of you, please first introduce yourself, and then we will go on with our discussion. Dr. Nicholas first, please.
Yes, I'm very happy for this meeting today. Thank you, Sam. Thank you, Anna. My name is Nikolaos Grigoriadis. I'm pharmacologist and a PhD in medical genetics. I'm responsible for one licensed biobank in Thessaloniki, Greece. And I'm working on the stem cell and cell therapies final 15 years in the clinical field. We'll be very glad to see all possible interactions and clinical benefits in cerebral palsy children, either in European Union or other area like Russia. So thank you for this introduction,
Thank you,
Sam.
Dr. Nicholas. Now, Mrs. Anna, go ahead, please.
good afternoon. My name is Anna. I'm just a mom of a 7-year-old CP kid who is looking for some new um, inventions or science or methods or approaches that can help my daughter and other CP kids around the world, but first of all in our country, in Russia.
Thank you for this introduction. Now we will go on with the questions which Anna received from many different parents of CP kids, and all of them are waiting to know the answers from Greece from our Dr. Nicholas. Anna, go ahead, please, with the first question.
Okay, thank you. So my first question is, let's imagine that here is a parent who doesn't know anything about stem cells in CP. And the first question is that I want to understand what is the exact mechanism that stays behind stem cells, how they can help in CP. Let's say maybe they make new connections between injured neurons in the brain, or how it works in general.
Okay, thank you, Anna. First of all, stem cells are primordial cells that are staying in different sources in our human organism, like bone marrow, adipose tissue, peripheral blood after mobilization. And except of these traditional sources, the final 10 years, we investigate also sources in different tissues like neural tissue, like muscular tissue, also different other sources of systems. So this is tissue-specific tissues. Today we'll discuss more for our experience in bone marrow stem cells that have different clinical mechanisms and the molecular characteristics regarding their therapeutic targets. These primordial cells or stem cells have some directed, indirect mechanisms in CP. The first mechanism is that when they are infused in the human organism, have immunomodulatory effects. They reduce inflammation, also modulate immune responses regarding the decrease of inflammation in the central nervous system. Except of immunomodulatory mechanisms, the second effect is trophic mechanisms, like they increase and upgrade the angiogenesis, and angiogenesis also cell survival and cell migration and proliferation. In this status, you have an effect known as paracrine effect. So these stem cells, when they are infused in the human body, they have the ability to activate endogenous stem cells in neural tissue and in different brain areas of CP children. The third molecular mechanism, except of immunomodulatory and the trophic effect, is the regenerative properties of these cells that they increase the regenerative growth factors that released by them. So they have the ability to replace the damaged tissue in the CNS areas. So is also the cell replacement. All these molecular mechanisms working together to have direct and indirect results in brain structure and connectivity of different areas in these children. So the primary effects is according to different instruments we're using for the clinical outcomes is the motor function, for example, and the other secondary effects is to reduce comorbidities in these children that is not only motor but non-motor associated. The final result after all these clinical interventions is to upgrade and to increase the quality of life on these kids because, as you already know, CP is an emergent treatment. Stem cell therapies have been in clinical research for more than 15 years now. They have concluded more than 50 clinical trials worldwide with more than 2,500 CP children. So we believe now that we are in a transformation regarding the time period to use these technologies in clinical routine here in Thessaloniki in Greece. So this was in brief the major molecular characteristics of these cells regarding CP.
Dr.
Okay.
Nicholas, I would recommend, please, if you could speak more simple language for parents to be able to understand, because your language is more for scientists, I believe. Number one, and number two, I want to understand myself how fast, when we say replacing the cells, does it happen immediately after the procedure, or this something takes a long time?
Yes, Sam. All these clinical benefits, they are reporting under specific instruments, clinical instruments that we are using to have to see the safety and the efficacy of these stem cell procedures. The most of the clinical trials that we are using specific instruments, the most use and ideal period is 6 months to 1 year. So from 6 months to 1 year is the follow-up time period to use if we have clinical benefits after the stem cell preparation and infusion to the CP children.
Okay.
After this period, the therapist and the physicians can decide if they are interested to repeat the infusion of stem cells in these children.
Okay.
Mhm. How can we assess effectiveness of stem cells? Does it mean that we can judge by making some investigations like MRI, or
Yes.
we can observe some improvements in the state of a patient? Just we can see that he's getting better, or both. So how we judge about effectiveness?
Yes, as I already told, the efficacy of the post-cell treatments follow-up is under specific instruments that we're using in clinical field, and to assess the general motor, the cognition, general development, the communication, the adaptive behavior of these CP children, the social emotional status. Also the neuroimaging, as told you, an MRI to see if we have some different follow-up, and also the safety. All these parameters are assessed by experienced and licensed neurologists that are working on the field and are fully responsible for the follow-up in these CP children using different instruments.
Mm-hmm. Are there any contraindications?
When I say instruments, I mean clinical instruments with specific guidelines regarding the follow-up of the children.
Mm-hmm.
For example, one is the performance, the GM-FM is the gross motor performance measure instrument to assess the benefits of each children after the infusion of the stem cells. This must be done under an official therapist that is experienced to use this instrument.
Okay. Are there any contraindications for stem cells? So those patients that are not allowed due to some reasons to undergo this procedure?
Yes. Should be mentioned that in each case is a personalized treatment. So the responsible doctor have a pre-operating examinations, pre-operative also testings regarding the status of the CP children, and in the most cases they have specific inclusion criteria regarding the age of its children between the limits of 2 years to 12 or 13 years old. Except of this inclusion criteria regarding the age, we have major inclusion criteria, exclusion criteria. In most clinical trials, previous cancer or tumor diseases or autoimmune diseases or other status regarding the immunologic profile of the children may prohibit the infusion of the stem cells in these children. But must be mentioned that in each case must have specific examinations before the selection of CP children. We have a team, an experienced neurosurgeon on this field is Dr. Zunzas, who will be responsible for the selection of the patient.
Okay. You mentioned that the results can appear in, as far as I understand, 6 months to 1 year. And if these results are positive, then you can repeat the procedure. How many times during the life this procedure can be repeated?
There is no limit, but in most cases, the major parameter is the age of the children. So we see that the plasticity of the brain is more upgrade in the ages between 2-3 years to 12-13 years old. So one contraindication is the age of the children, and we can repeat it according to professional decision, because here we are experienced and we are licensed for the processing of the stem cells. Physicians and doctors, which are responsible for the patient, will decide the clinical benefits if are statistical crucial. And after this, we can repeat the procedure in each year, or maybe 2 years. But there is no limit until now in clinical trials regarding the repeat of this therapy. The major clinical endpoints is safety and efficacy for these procedures. In collaboration with doctors from Russia, for example, we can establish specific also timelines regarding the repeat or not of these procedures.
Can we say that in some cases stem cells can replace a surgery? I mean, for example, let's take the situation when CP kids, they have like contractures, so some problems in soft tissues that limit their progress in mobility. And the question is, can we like avoid surgery, orthopedic surgery, for example, by injecting stem cells, or it depends on each child?
Yes, as I told before, this is the secondary effects. We trying now to reduce all these motor and non-motor associated problems for these children. But the final decision is not according to us, but starting from the therapists that are responsible for the kids. So we cannot and we are not able to decide if we can avoid surgery for these children. If we can have our benefit and our aim is to increase the quality of life for these children, and of course we see improvements every day regarding our outcomes. And all the others non-motor associated comorbidities, I say, regarding the cognition behavior, may be indirectly targeted by these cell treatments. So as my answer is
Okay.
that this decision coming 100% from the doctor that is responsible for the treatment of the child, not from us.
Which is normally neurosurgeon, right?
Yes, in most cases, is a team of neurosurgeons, orthopedics, some experienced, specialized neurologists in this field. That also we desire this also interaction with us to see the improvement after the cell intervention. So if this treatment coming in starting in Greece, we must have also a connection with the doctor that is responsible for the child to have a follow-up for our records.
Okay. Anna?
Yes, I think it's my last question, just to understand how the whole procedure looks like. So, I mean, does the child have any anesthesia? How much time there is a need to stay in the hospital? So, just to understand how it goes.
Yes, the procedure is simple. The parents coming in private hospital in morning have specific before surgery specific examinations from the doctors here. If this is successfully done, we'll go forward to the bone marrow selection. We collect bone marrow specific according to the body weight of the patient. Is a personalized algorithm to have specific cellular concentrations of stem cells. We have a filtration of bone marrow into the surgical room, and we have the manipulation of the stem cells is minimal, is a minimally manipulated the bone marrow according to the European Union legislation. To be infused according to medical practice. After the minimally manipulation of the bone marrow, we centrifuge the graft. We extract the stem cells in the mononuclear cell cluster. That in this mononuclear cell cluster contains the hematopoietic stem cells and a rare mesenchymal stem cells. So the final cell cluster that we are going to infuse to the patient via intravenous and intrathecal route is mononuclear cells that contains hematopoietic stem cells and mesenchymal stem cells. Our decision to use mononuclear cells in these children is according to the clinical literature that, as I told before, we have more than 50 clinical trials worldwide that assess all the safety, efficacy, and benefits for the kid. But this is in general terms, the procedure. The infusion done via two different routes. One is intravenous, the second is intrathecal. We have also, after the infusion of the stem cells, a time period of 1 day to see possible also maybe problems regarding infusion, which is very rare, like a small fever or a headache. And after this, the next day, the child and with his parents going out of the clinic.
So it is
So it's a 1 day procedure.
hours. So it's 24 hours, and the cells will be injected in the vein and in the spine column. Is it right?
Yes, exactly.
Yeah.
Exactly. Yes.
Okay.
It's an autologous procedure. Is a medical practice. Is a minimally manipulated the bone marrow according to the laws of European Union, because if the bone marrow is processed using different other methodologies, is not a medical practice, is advanced therapy medicinal products. So the guidelines and the laws is different in this case. It must have a specific license from the drug organization or the European Medicinal Agency. So all these procedures done in a point of care into the surgical room, the collection, the processing, and the infusion of the stem cells. The child staying 1 day, and the next day we finish the whole trial. And in
Okay.
this case, must be mentioned that in EU and that maybe I think in Russia is the same procedure. Stem cells has very strict legislation regarding the infusion and transplantation of the cells. So
Yes.
all of our standard operation procedures in this trial is done according to the final legislation as a point of care cell therapy.
Mhm.
Any other question, Anna?
Right now, no, but
Okay.
I think maybe in the future.
In the future.
Um,
Okay, I will ask one more question uh, about the something which we always hear from the parents. Stem cells is an experimental procedure. Can also harm the child or do something bad to the child.
Yes, the use of stem cells and cell therapies in CPs, as I told, starting before 15 years. Now FDA has an emergent treatment using bone marrow or cord blood for these children. Is starting now to transfer the experimental status of these infusions to clinical routine for CP children. And now
Mhm.
we are in this time period. So we have already assessed in previous years the safety and the efficacy of these treatments. So we see that in more than 90% of our indications, we have no undesirable events on these children. So is a minimally invasive procedure with none or at least very low rates of undesirable events. And we believe that it's a very safe procedure for the children from Russia to have the autologous cell therapy. So my answer is a very, very low rate of undesirable events and harmful for children.
Yeah, the question is not only about the during the procedure itself, about the operation, but is about in general. Can the cells of the same person, when will be spread everywhere in his body, can create something, can create something else, can have, for example, we hear from many people, can make any cancer or something like that?
yes, I hear this fear from many mothers. They are asking this question about cancer.
Yes, this is a very crucial question regarding the science. As I told before, the focus of our experience is adult stem cells. In the final 30 years, when the cell therapy started in global area, we do not have any report of any cancerous diseases using adult stem cells. When I say adult stem cells, I mean bone marrow, umbilical cord blood, or adipose tissue. Some reports that are starting for infusion of stem cells coming from embryonic stem cells. This is a very different kind of stem cells that they have by far is more heterogeneous and have the ability to create different tissues different from their origin. So we don't use embryonic stem cells because according to the EU laws and the Greek laws generally, we cannot use this kind of cells in clinical practice. And in clinical literature, we have reporting cancerous diseases after the infusion of embryonic stem cells, but not from adult stem cells that are used in clinical practice 30 years now. So this
Any
is my question.
difference? Yeah,
I,
any difference if the child was IVF or not?
No, there is no any contraindication if the child is coming from IVF or from
Okay.
physiological
Thank you
delivery.
very much, Dr. Nicholas, for your time. We understand you are very busy, and we really appreciate the time you gave us. And on behalf of all the parents and on behalf of our organization, we really appreciate your time. Thank you so much. Anna?
Also, I
Thank you.
hope to be really a good start to help and have the benefits of CP children from Russia here in Greece, Thessaloniki.
Thank you very much.
Together
Thank
we
you.
will. Thank you very much.
Okay.
Have a good
Bye
day.
bye.